go for the injury chapter, that is on injury due to electricity, that is called electrocution. So usually what are the electric supply observed in our society, that is one to our domestic supply, it is 220 to 240 volts with 50 amperes, whereas the industrial supplies are the 4 lakh volt, and whereas lightning it is up for millions volt. So the factor involved in the electrocution, so it depends upon the itself the electricity or electric supply and the factor related to the human. If it is on the electricity, then it depends upon the voltage, the current, form of current, and the amperage. And the related to the human or the victim, that is resistance of the body tissue, area of contact of the body, duration of contact, and the yarding or insulations. It is observed that the AC current or the alternative current are more dangerous than the direct current. It depends upon the amount of current. Electrocution is very rare if it is the voltage if it is less than 100 volt, and usually observed if it is the voltage is more than 200 volt, and it is also depends on the path of current flow. So death is more likely occurs if the brain stem and heart are in the direct path of the current. The current enters at one point and it will leave the body at some another point, that is called exit point, and it will exit to the earth, and the current tends to follow the shortest route. The current flow also depends. Then cause of death also depends on the duration of the current flow, and it is observed there is a primary cause of death and a secondary cause of death. The primary cause of death, if current flows to the, or if on the path of the current heart comes, then it is ventricular fibrillations. If brain stem comes, then there is paralysis of the respiratory center. But there is also secondary causes of death. The secondary causes of death as due to, there is a possibility to get injuries due to the electric shock. There is possibility to get burn injury due to the electricity, and there is possibility that there will be burn or mechanical injury subsequently followed by infection leading to death. In the autopsy finding, what we are getting, what type of injuries usually getting from the electricity. There are 3 type of burn injuries we will observe. One is contact burn, second is spark burn, and third is flash burn. The contact burn, again, it is at the contact site. If on the contact site the electricity contact with the body, that site is known as the entry wound, and in which side it is passed to the earth, we are telling that is the exit wound. We will get on both the wounds on the entry site as well as on the exit site. The entry wound site, what the type of burn is observed, that is a endogenous burn, that is called joule burn. What is the definitions of the joule burn? Joule burn is a electrical burn injuries found over the body at the point of entry of electric current, and the features of the joule burn, it is round to oval shape, having a shallow crater surrounded by a ridge of skin. The floor pale looking flattened skin is surrounded by hyperemic zone, and sometimes it resembles the size and shape of the object causing it. That means if it is a live wear, and the wear pattern will observe on the body of the victims. So for that only we are telling it is a pattern or imprint electrical injuries. So see these injuries photograph. having a pale base on the palm with a raised margins. Come to the pathogenesis of joule burn. So when there is a contact of the electricity to human tissues, there is conversion of the electricity or the electric current into heat energy. So because of this heat energy and the unit of heat is joule, so we are telling it is a joule burn or endogenous burn injuries. Common site, it is commonly found on the exposed part of the body, especially on the palmar aspect of the hand, and it is specific and diagnostic of contact with the electricity. We can tell it is the entry wound of the electricities. On the exit wound usually observed on the, especially on the leg, where the leg is contact with the earth, so that this energy, this electricity will not store in our body, it will definitely pass somewhere when it is contact with the earth. It is variable in appearance, more damage to tissue, present a split wound having a ridge or inverted margins. Burns and perforations of the clothing or shoes may be seen over the site of exit, commonly seen in the foot. So this is a photograph that shows the exit wound. The burn injury of electrocutions may be absent, though it is a case of electricity injury. If there is a large area of contact with low resistance, very small area of contact with low voltage current, or there is a brief contact with a live wire. So large area of contact with low resistance means if the person having wet body, suppose is a, the body is wet, so there will be low resistance, and if there is a large area of contact, so there is possibility to not getting this burn injuries. Come to the spark burn. Spark burn as a result of poor contact with live electrical appliances, and because of the resistant of dry skins, we will get spark burn. And there is a another flash burns. So these flash burns are almost like a flame burns, and these are the exogenous burns. It is observed when there is a very high voltage current passes by and not through the body, but the intense heat resulting from the flashover may produce burn resembling a thermal burn injury like flame burn injury. It is actually the true burn injuries. This having a different characteristics, not like is in the normal thermal injuries. There is a multiple burnt punched out lesions are produced due to the arc dancing over the body surface over a large areas, which presents like a crocodile skin appearance, that is called crocodile flash burns. See the pictures. This is a crocodile skin like appearance that is punched out burns areas in the skins. Here also see these pictures. So medical legal importance of this burn injuries, usually accidental, that also rarely, if sometimes we are giving a treatment known as electroconvulsive therapy in a case of very high depressions. Suicide and homicides are very rare. There is a form of judicial electrocutions where it is carried out in a electric chair, and it is practiced in some state of USA, and it is the capital punishment of that state that they will give death sentence by the judiciary through judicial electrocutions. The procedures is the person strapped to a wooden chair with one electrode at scalp and other on the right leg. The voltage is 2000 volt, whereas the ampere is 7 amperes, and they will use for very short period like 1 minute. When they switch on, there is tetanic convulsions of the persons, and then become unconscious. Then they repeat again for 1 minute so that the brain is heated up to 60 degree and vacuolations occur around the vessels and the person will die. So this is all about the electrocutions. Thank you.